A hiatal hernia is when the top of the stomach gets displaced or herniates through the diaphragm and up into the chest cavity. Although most people with a hiatal hernia do not experience any symptoms, others may suffer from recurrent symptomatic reflux requiring medication or even surgery. Reflux more readily occurs because the esophageal length is now shorter and the sphincter between the stomach and the esophagus is often unusually loose. Surgical repair essentially involves pulling the stomach back into the normal position fully below the diaphragm and making the opening in the diaphragm smaller. Check out our other animations on hiatal hernia repairs for more information on how this condition is surgically corrected.